Patient safety and restraint alternatives. Accidents and incidents. An accident is an unintended, unexpected event that has potential for causing bodily harm. For instance, if a patient falls, we know that's an accident. An incident is an occurrence that is considered unusual, undesired, or out of the ordinary that disrupts the usual routine of the patient, the resident, or the facility. For instance, if a patient is maybe agitated or hallucinating and he strikes another patient or he strikes a visitor, that would be considered an incident. Accidents and incidents can involve patients, residents, staff, visitors, or the facility. If a person falls, I want to remind you that that is an accident and you need to tell the nurse immediately, even if the person doesn't harm himself. Accidents and incidents. Facilities are required by OBRA to maintain an environment that lowers the risk of accidents and incidents to the greatest possible extent. Facilities achieve this by providing patients and residents with adequate supervision and assistance to prevent the occurrence of accidents and incidents. Question 1. Accidents are always incidents, but not every incident is an accident. True or false? Answer true. Every accident is an incident, but some incidents are not an accident, but they are intentional. Just like I said, for instance, one resident may strike another one, and that is an intentional act. It's not an accident. Risk factors that cause accidents. Some factors that place people at risk for accidents are age. For instance, an elderly, frail person may be at risk for accidents. A person that's on medication, for example, blood pressure medication, it can cause you to be dizzy or lightheaded. A person that's paralyzed can't move from the waist down, they are also at risk. Poor mobility, if a person can't walk with a steady gait, they are at risk for falling. Remember that falls are the leading cause of death. Sensory impairment, those that are diabetic, burn victims, maybe they can't feel warm or hot water, that also puts them at risk for an accident. Limited awareness of surroundings. Maybe if a person has dementia or if they're detoxing off of medication. Risk factors involving age. For instance, we all know that infants are helpless. There can be accidents such as accidental suffocation, falls, and young children, there's a lack of knowledge about dangers such as, again, falling, burns. They'll touch maybe a hot stove burner or a plate. Also, poisoning and drowning occur among young children. The elderly are at high risk for accidents because of the physical and mental effects of the aging process. Risk factors. Medication. Many medications can affect the ability for a person to remain safe, including ingesting of pain medications such as Vicodin, opiates, any other medication that may impair our thinking can cause us to be unsafe. There are medications also that affect the blood pressure. The effects of blood pressure medication may cause dizziness. There's also sedative effects of medications, sleeping pills, or even Benadryl can cause us to be tired and have an accident. Risk factor, paralysis. Paralysis is a person is unable to move or feel a part of the body or parts of the body, and it puts the person at risk for falling, burns, and other injuries caused by a spinal cord injury or a stroke. Paralysis is from the waist down. Paraplegia, paralysis from the neck up, is called quadriplegia, and paralysis on one side of the body is called hemiplegia. Risk factor and poor mobility. Factors associated with poor mobility can cause falls. pain, arthritis, stiffness, conditions that cause a person to shuffle their gait, maybe medication, maybe a stroke, injuries, or surgeries involving the leg or legs. Risk factor, sensory impairment. Visual impairment can lead to falls. So ensure that your resident area is well lit, it's free of clutter and hazards. Unfamiliar surroundings can cause falls. Hearing impairment can also lead to falls if they're unable to hear another individual like yourself directing them away from an object. If the resident drives, hearing impairment, of course, can cause road accidents. Sight impairments can cause ingestion of poison or accidental use of another toxic item, thinking that it's their eye drops or another item. They can reach for something poisonous and ingest it. Impaired sense of touch can also lead to accidental burns. For example, those with diabetes that have neuropathy and don't have much feeling in their fingers. Impaired sense of smell can also lead to food poisoning when you can't smell what you're eating. It can lead to suffocation or fire accidents due to a gas leak that they're unable to sense. Risk factor, limited awareness of surroundings. If a patient is confused or disoriented, could be caused by reactions to medication. If they have a head injury, dementia, or other conditions can lead to accident. A person who's unconscious or comatose is totally unable to respond to his or her own environment and needs assistance to remain safe. Special needs regarding safety. OBRA requirements. All staff must be alert for any potential unsafe condition. Physical changes of aging that can have an effect on medical conditions or treatments and environmental conditions. Physical changes of aging. Neurological changes. For the elderly, it takes longer to regain balance or change course, change direction. There's sensory changes, and your sensory changes also decrease with age. It's difficult to detect and respond to danger. Musculoskeletal changes. People that are elderly, of course, are weaker and they fatigue more easily. Physical changes of aging. There's urinary changes, we know. There's an increased frequency and urgency with age and incontinence, of course. Respiratory changes. As we age, we become shortness of breath during physical activity. There's also skin changes, increased bruising, and skin tears. Effects of medical condition or treatment. Chronic health condition. Treatment or both can increase the risk of accidents or incidents. Medication effects. Again, we talk about blood pressure medication, which causes dizziness when standing and also can cause falls. Environmental conditions. A new resident confused and disoriented by change of environment has an increased risk of accident or incident. Also, changes such as many residents with varying degrees of disabilities in one place. Long care facilities are very busy places. There's increased risks of environmental hazards. We mentioned clutter earlier, slippery surfaces. If your patient is ambulating, ensure that they're wearing non-skid socks and shoes. Poor lighting is also a cause for potential falls, and or sun glare can cause falls. OSHA requires that all staff members working in a nursing care facility be alert for any situation that might be an unsafe situation. True or false? This is a tricky one. False. This is an OBRA requirement. Avoiding accidents. Avoiding accidents. Many accidents can be prevented. Most safety measures require an extra step. Extra steps help protect others. Preventing an accident or incident is less time consuming than dealing with the accident or incident after it occurs. Preventing falls. Falls are the leading cause of fatal death and non-fatal injuries in the United States among the elderly. Falls are most common cause of a functional decline, hospital admission, emotional trauma, eventual placement in a nursing facility for older people. Preventing falls. Evaluate each resident or patient for fall risk. Include prevention measures in the resident's or patient's nursing care plan. Preventing burns. Elderly have a decreased sense of touch. Check water temperature with thermometer meter before allowing the patient to get into the bathtub. Should be between 105 and 115. Water for a bed bath can be hotter, between 110 and 115. Allow your resident to touch the bath water or shower water before they enter and ask them that if it's acceptable, if it's too warm for them. Preventing burns. Instruct the resident to check the water temperature if he's bathing himself before getting in, as we mentioned earlier. Use extreme care with heat applications. Warm the patients if the food is too hot or the drink might be too hot. Use cups with lids if the patient or resident is weak or unsteady on his feet or has shaky hands in a wheelchair. Just follow the guidelines when using electrical appliances. This is entrapment. This is a diagram illustration of entrapment and the dangers of the side rail. You can see in each one of the pictures depicts a very potentially serious outcome, including death. So this is why it's really critical that you follow your facility policies, ensure that those side rails are not up unless they are ordered by the doctor, and ensure that your patient is safe at all times. Check on your patient as needed to prevent this type of accident from occurring. Entrapment occurs when a person becomes trapped in the side rail or between the side rail and the mattress. This can result in a severe injury or death. Residents who are confused or have physical disabilities are at the highest risk. Always use side rails as ordered in the nursing care plan. Perform frequent checks on your residents. Restraints, if they are restrained in any way, are removed every 2 hours for at least 10 minutes. Use all safety devices correctly. Possible complications of restraint use: urinary or fecal incontinence, death, negative impact on the person's quality of life. Accidental poisonings. Elderly are at risk. Poor eyesight, confusion, decreased sense of taste or smell put the elderly at risk. They could take too much of the medication or the wrong medication. To minimize the risk, properly store household chemicals. Keep them locked up. Make sure that they are clearly marked with the contents they contain, and provide help with reading labels. Reporting accidents and incidents. Reporting. An accident should be reported immediately to the nurse, and an incident occurrence report should be completed promptly. The report is to be completed in a way that is objective and non-judgmental, without blaming anyone. It's used by the Quality Assurance Department. An incident report is used to make improvements in safety. It's important to follow up because they may show a trend and suggest changes to prevent future accidents. Using restraints. Restraints are used to restrict a person's freedom of movement, prevent a person from reaching parts on his or her body, confine a person to a bed or a chair, prevent movement of a specific body part. Restraints can either be physical or chemical. Physical restraints. A physical restraint can be applied to wrists, ankles, chest, waist, arms, or elbows. Some types of chairs or attachments to chairs can act as a restraint. For example, as pictured above, the recliner. It prevents a patient from standing, and that would be considered a restraint. Side rails on the bed, if they're not ordered, or tightly tucked sheets can act as a restraint as well. Here's some illustrations of restraints. Mitt restraint, vest restraint, jacket restraint, and lap restraint. They may vary from facility to facility. A medical mitt restraint may be used to prevent a patient from pulling out a catheter. Physical restraints consist of tightly tucked bed sheets, raised side rails when there is no order, check with your facility policy, a tray table attached to a chair are considered physical restraints. If a person has mobility issues, ensure that they have ready access to their mobility aids, their walker, their wheelchair, to prevent falls. Additional pictures of physical restraints: the lap buddy, the chair with the tray table would be considered a restraint if that person could not remove it. Make sure that they have a care plan and that it's been ordered. The wrist restraint here on the side of the bed, again, ensure that there is an order and that the tie is done correctly for easy release. Tips to remember: when using a vest restraint, ensure that it fits properly and that is the exact size and in good condition. A vest restraint is placed to ensure that the flaps cross over each other over the patient's chest. Number 2, avoid the use of side rails unless they are necessary and ordered. Number 3, if a patient is having trouble breathing, report this immediately, especially if they're wearing a restraint of any sort. When are restraints used? They're used when a resident needs to be protected from harming himself or others, and all other methods of keeping the person safe have failed. Chemical restraints. A chemical restraint is any medication that alters a person's mood or behavior. Chemical restraints, medication, are sedatives or tranquilizers. Chemical restraints are used to calm an anxious, combative, physically aggressive, or agitated, very upset person. Chemical restraints are not used for staff convenience. Chemical restraints should not be used in such a high dose as to make the person sleepy or unable to function in a normal fashion. Using restraints. Example of some situations where the use of restraint may be appropriate. A person is at risk for falling but will not stay in his bed or chair and will not call for help. In this type of situation, please check with the nurse to ensure there is a care plan and a doctor's order is in place and you're following your facility's policy. Use of restraint may be used if a person may wander away from the facility. A restraint may be used if a person tries to remove tubing as needed for medical treatment. Maybe they'll be ordered a mitt in order to prevent them from pulling their tubing. If a person is combative and physically aggressive, they may use restraints. If a person is going through withdrawals and as a suicide precaution, they may use restraints. Using restraints. You must follow the guidelines from OPRA, Joint Commission, and the FDA. A thorough assessment by the healthcare team should be performed. Benefits of using restraints must outweigh the risks. Improper use is considered false imprisonment. You must understand and follow the facility policies. Failure to follow the facility policies could result in litigation. Complications associated with restraints: strangulation, which can lead to death, bruises, nerve damage, and skin abrasions. That's by improperly applying or using the restraints. Permanent tissue damage as a result of impaired blood flow. That's why you need to check the restraints. Broken bones can occur. Pneumonia from laying down and aspiration. Pressure ulcers can result. Blood clots, incontinence. Loss of dependence leads to loss of function. Mental effects such as agitation, increased confusion, humiliation, and embarrassment are complications of using restraints. Restraint alternatives are absolutely necessary. They must be sought out and used before you restrain a person. You must document the use of restraints and what you did prior to using the restraints. Alternatives consist of providing an environment where the person feels safe and secure. Ask a volunteer to sit and interact with the patient or resident that is agitated. Have a pressure-sensitive bed. Have a sound alarm that will alert staff when the patient's walking and maybe should not be or needs assistance. Wandering and monitoring systems that are attached to the wheelchair or the bed, the ankle or the wrist, that sounds alarm before the patient harms himself. Alternatives to restraint. Provide frequent attention. Explain procedures to the patient and reassure the patient. Get help from family members. Maybe contact them and ask them if they will speak with the resident if it's appropriate. Use postural supports. Maybe if someone's falling out of their wheelchair, postural support will be more helpful than a restraint. Use bed control bolsters instead of side rails. Side rails, as I said earlier, can be considered restraints. Applying restraints. Only a doctor can order a restraint for a patient or resident. Always follow your facility's policy regarding the application and the use of restraints. Only a registered nurse or licensed practical nurse, LVN, can apply a restraint. Nursing assistants are responsible for providing care for the person while he or she is being restrained. Report any signs of trouble. Applying the restraints. There are various types: vest, wrist, ankle, lap, and waist belt. Question 3. You come to work one day and find 2 of your colleagues have just called in sick and no one else is available. There will be just 2 of you to take care of all of the residents. There is a concern about one of the residents that needs extra attention or will cause problems. So you and your colleagues decide to restrain that person to a chair and make it easier for everyone to care for this person. Will this be okay just this one time? Yes or no? No. Although restraints are sometimes necessary to help ensure patient safety, restraints are never to be used to punish a person or for the convenience of staff. The end.